beginning today's sessions with a closed session. Mrs. Anderson, would you please read the motion to go into closed session?
I move that the school board recess into closed session in accordance with the exemptions to open meetings law set forth in Code of Virginia 2.2-3711, Part A, paragraphs 1, 7, and 8 as amended. A1, discussion, consideration, or interviews of prospective candidates for employment, assignment, appointment, promotion, performance, demotion, salaries, disciplining, or resignation of specific public officers, appointees, or employees of any public body, namely to discuss 1, superintendent's mid-year evaluation and related matters. A7, consultation with legal counsel and briefings by staff members or consultants pertaining to actual or probable litigation, where such consultation or briefing in open meeting would adversely affect the negotiating or litigating posture of the public body. For the purposes of this subdivision, probable litigation means litigation that has been specifically threatened or on which the public body or its legal counsel has a reasonable basis to believe will be commenced by or against a known party. Nothing in this subdivision shall be construed to permit the closure of the meeting merely because an attorney representing the public body is in attendance or is consulted on a matter. And A8, consultation with legal counsel employed or retained by a public body regarding specific legal matters requiring the provision of legal advice by such counsel. Nothing in this subdivision shall be construed to permit the closure of a meeting merely because an attorney representing the public body is in attendance or is consulted on a matter, namely to discuss 1, pending or probable litigation matters and developments in the election districts. 2, receive legal consultation regarding the compliance with school board or Senate Bill 1303 and the governor's executive order number 2 and ramifications. Motion is made by
Mrs. Holtz,
is there a second?
and a second, Mrs. Franklin. So all in favor, show of raised hand, please.
Madam Chair, we have 8 ayes. The motion did pass to go into closed.
Thank you. All right, so.
convened a closed meeting on this date pursuant to an affirmative recorded vote and in accordance with the provisions of the Virginia Freedom of Information Act, and whereas Section 2.2-3712D of the Code of Virginia requires a certification by this school board that such closed meeting was conducted in conformity with Virginia law. Now therefore be it resolved that the school board of the city of Virginia Beach hereby certifies that, to the best of each member's knowledge, only public business matters lawfully exempted from open meeting requirements by Virginia law were discussed in the closed meeting to which this certification applies. And two, only such public business matters as were identified in the motion by which the closed meeting was convened were heard, discussed, or considered. Is there a
Okay,
motion?
there's a second.
Is there a motion? First a
Oh,
motion.
that
Motion.
is a motion, isn't it?
No.
Okay, so motion is Mrs. Riggs and a second is Mrs. Hughes. All in favor, show a raised hand, please.
Madam Chair, we have 9 ayes, so the motion did pass. The certification of closed.
Thank you. And we'll gavel in just a moment, Mr. Den, for Good afternoon. I'm Carolyn Rye, Chair of the School Board of Virginia Beach. This administrative, informal, and workshop session of the meeting of the school board is hereby convened at 3:30 p.m. on this 25th day of January 2022. Pursuant to the school board's 2021-22 reopening plan adopted August 10th of last year, and the school board vote on August 24th regarding health protocols for school board meetings, it's determined physical distancing will be used in chambers as a health mitigation strategy. Members of the public, as always, are able to observe the school board meeting through live streaming on vbschools.com, broadcast on VBTV Channel 47, and on Zoom. It is this board's protocol to break at 5:30 to prepare for the formal meeting. At 5:30, we will conclude this session unless the school board votes to continue until 5:45, but we will conclude no later than that time to allow the board and administration to prepare for the formal session of the board at 6 o'clock. So we welcome our viewing public and those present. And with that, Madam Clerk, would you please announce those school board members in attendance?
Thank you. President School Board Chamber is Chair Y, Miss Weems, Miss Manning, Miss Hughes, Miss Owens, Miss Anderson, Miss Holtz, Miss Riggs, and Miss Franklin. And presently, there are no school board members attending via Zoom.
Thank you. And for the record, Mrs. Melnick will be joining in for health reasons electronically at some point, and Mrs. Felton, our other colleague, is in Richmond on VSBA business. I'll remind the public that she serves as the Tidewater VSBA chair, so she is representing not just us but other local districts in Richmond today. Okay, so we begin with administrative matters, and before I bring up what I need to, anybody else? All right, so then I will just bring up what was recently, where we recently landed with February 1st, which is we have our 3 o'clock session with outside counsel. That remains on the schedule. And the special meeting remains for 5 o'clock with it. There's going to be a change in the call. It was originally the superintendent estimate of needs, which has been deferred, and we are substituting instead a special meeting on the election districts. Do you want to add to that, Mrs. Linetti?
No, ma'am, we'll get the wording for the call, but my understanding is you would like to discuss publicly where you are, the election districts, and what your intent is in establishing how the school board will comply.
Just for information purposes, Mrs. Melnick just texted that she's having trouble getting on the Zoom.
Okay, we'll ask our tech folks to work on that. Thank you, Mrs. Anderson. All right, with that, we will move right into our first topic of the day, an all-important
What did we decide upon the meeting?
5 o'clock with the change in the call to discuss the election districts.
5 o'clock on the 1st.
Right, it said
And-
the 3 o'clock time remains with the outside counsel.
Okay,
That
and then
was
5 o'clock just for
pre-scheduled.
discussion on, and no public comment.
We're working, I mean, typically there wouldn't be with a special meeting, but we'll work on,
I'm not sure what the public would comment on. They haven't heard any
Yeah,
discussion from the board
exactly.
on this.
Yeah,
So it would make sense to me that you would have a
Okay.
discussion. You have a formal meeting the following week. You could certainly add an information or action item at your discretion.
okay.
And that would allow the public to have the opportunity to then comment on the discussion that you have on the 1st. And then our intention would be to add the superintendent's estimate of needs as an information item on the 8th.
Okay, that sounds good to me.
okay, so to recap again, next week, 3 o'clock and 5 o'clock. Thank you. So getting back to Mr. Freeman, so another all-important COVID update. Welcome, Mr. Freeman, our Chief Operations Officer.
Good afternoon, Chairwoman Rye, members of the board, and Dr. Spence. Today's brief will largely be focused on the continuing updates that we received related to the Governor's Executive Order 2, including guidance from the Virginia Department of Health. Dr. Robertson will address that topic. Dr. Caitlin Padati, the Director for Virginia Beach Department of Public Health, is with us again via Zoom today and will be available to take your questions at the end of the brief. Our goal for this school year continues to be safely maximizing 5 days of in-person learning. Our layered prevention strategy has been designed to deliver on that goal. Before Dr. Robertson talks about how we are adjusting based upon the continually updated guidance, this is the most recent slide from the Virginia Department of Health showing community transmission in Virginia Beach. Virginia Beach is in the high category for level of transmission with 1,425 new cases per 100,000 in the last 7 days, and percent positivity is 36.1%. Next to those numbers in gray, you can see what was reported at the last school board meeting. Over the last 2 weekly updates, the spike has halted and numbers have reduced a bit. CDC and VDH continue to emphasize the importance of vaccination. Here's the progress for this round of vaccination clinics. The cancellations were due to recent snow event, and there's plenty of availability still, and all versions of the COVID vaccine and boosters are available at these clinics. Last part I want to cover, we are in the process of purchasing KN95 masks, as we talked about at last Thursday's special school board meeting. We've narrowed the options down to 2 vendors. The last step is to verify the quality of the masks. As you know, fake KN95 masks are common, and we need to verify that we're getting the product that meets standards. If both vendors have masks that meet the standard, we may, and I'll emphasize may, be able to have these masks in less than 2 weeks. If only one meets the standard, it could be 3 to 6 weeks before we would receive a shipment. I'm happy to provide more detail during the Q&A if needed. I will now turn the brief over to Dr. Robertson.
Thank you, Mr. Freeman. Good afternoon, Chairwoman Rye, Vice Chair Melnick, members of the board, and Dr. Spence. Before we transition into the remaining part of the presentation, I thought you might enjoy these pictures as evidence that education and school activities continue in our schools. Pictured here are Kings Grant Elementary School students learning about hibernation to prepare for winter weather. Young men came together for the 14th Annual African American Male Summit. Lansdowne Middle School cheerleaders go to the team competition, and Cox wrestlers competing at the Virginia Duels. I thought it might help to set the stage for the next slides by taking a moment to look back at how the evolution of COVID-19 has impacted all of us as it continues to stubbornly require we accept sudden change. No one in this room would have dared to predict in March 2020 that we would still be dealing with the daily impacts of COVID-19, some foreseen and others not. After all, it was 2020, and this was America. There's nothing this great country cannot overcome and do so in a short time. However, this has not been the case. Recall in the first few months of the virus, we wiped down everything before touching it without a gloved hand, as we thought the virus lived on surfaces for extended periods and would infect us in that way. Now we know this was not the case. Our understanding of COVID continues to evolve. Since March 2020, we have seen guidance from the CDC and then the VDH change over time. We have seen change in our elected officials at the state and national level. The confluence of these outcomes has impacted all of us in how we perceive governance. As we learn more and the initial virus variant slowed, along came Alpha, then Beta, and then in 2021, Delta, which once again brought us back to ground zero. Not to be outdone, though, while we were meeting success in addressing the Delta variant, along came Omicron, which is less virulent but much more contagious and has caused unmatched transmission in our community over the past several weeks. In short, we have every reason to be tired and to yearn for a return to pre-COVID life. The ability to address change is based on many, many factors. Every person deals with this in their own unique way. Some move easily through the change process, while for others, it's crippling. This needs to be understood as we, leaders and decision makers, plan for how to best address this ever-changing environment. Recently, a dear friend who served in the United States Marines and did 3 tours in Vietnam said to me, "This pandemic has brought me back to a dark time in my life. When I completed my last of 3 tours and returned to the United States in 1970. For almost 3 more years, we fought that war, and what I saw and heard at home from my neighbors then is eerily similar to what I see and hear now. We must find a way to work together when faced with change, because change is a constant with this virus. We must seek to agree to disagree, and to do so in an agreeable manner. And now we face another crossroads as we work to address Executive Order 2 and new guidance from the VDH. After the school board voted on Thursday last week, the VDH posted new guidance on Friday based on Governor Youngkin's Executive Order 2. Highlights of this guidance are captured on this slide. The new guidance outlines new and revised strategies to prevent transmission of COVID-19 in our schools. It shares responsibilities between parents, educators, and schools. It notes fully vaccinated individuals or individuals who have had COVID-19 in the last 90 days are exempt from quarantine. Unvaccinated individuals must quarantine for at least 5 days. Now, what I think that is important there is over the weekend, that statement got attributed to Virginia Beach City Public Schools making that decision. So let me point out, as you will see in a moment, that was not Virginia Beach City Public Schools language. That was language out of this document. It further offers the ability to return on day 6 if symptoms are improving and the individual is fever-free and can wear a mask at all times when around others. So let's talk about that for a moment. Last week on Thursday, we talked about that we would not be allowing any students to come back after day 5, prior to day 10, regardless of whether or not they were vaccinated or not. Because quite frankly, the implementation of that plan, given we being teachers, and this is where my focus is, on teachers whose focus should be on instruction, are not going to know every kid in the school whose parent has submitted an opt-out form. They're not going to know every kid in the school that is returning to school from being quarantined. So we would be putting our teachers in a situation where there is no way they would be able to know whether or not a student should be able to benefit from coming back early, days 6 through 10 or not. So we made the decision in our recommendation that we would not allow that. On Friday, the new guidance came out, and this is what the new guidance says. Yesterday, this new state superintendent and our new Virginia Health Director, Dr. Colin Green, presented to the school superintendents, and he clarified that Governor Youngkin's Executive Order 2 does not apply to any student who is returning from isolation or quarantine and wants to do so before the 10-day period is up. He said anyone who wants to come back after 5 days because they are symptom-free and fever-free can do so, but they must wear a mask at all times when around others. That was guidance that was just clarified Friday and then repeated yesterday. So as a result, we're going to adjust what we said last week because new information has come to us, and we will be sharing with everyone that if you are quarantined or in isolation and you're fever-free, symptom-free after 5 days and you want to come back to school, you can do so, but you must wear a mask at all times when in school buildings. This order also eliminates masking as a standard mitigation strategy. First time we've seen that. So what I'd like to do right now is ask Ms. Donato to open this document. I want to walk you through some of the things in this document. Now, this is not something I've ever done. I've been presenting to this board for 10 years, but this document is too important to miss. So I'm going to take a moment to go through, and I'd like you to follow with me on the screen, some key elements. First, I want to start with this area right here. There are 3 core principles found in Executive Order 2 that reaffirm the guidance to come. The first, parents are in charge of their children's health, well-being, and education. Second, schools must be open 5 days a week for in-person learning. And 3, the Commonwealth and school divisions must provide a safe and healthy school environment. And you might be wondering, why did he say Commonwealth twice? Well, we've had parents request the virtual option. So we asked the state superintendent yesterday, could we expand Virtual Virginia to provide opportunities for our families who want a virtual option? And their answer was the same answer they gave to us in December. And that is, if there are seats, and if they have a documented medical need, or they are a military transfer, or they are a new student transfer, we will try to accommodate. I'll leave it at that. Next paragraph. This first sentence is critical. With freedom comes responsibility. With freedom comes responsibility. This guidance clarifies the roles of parents, educators, and the schools. So let me be clear to the viewing audience. I am reading directly from the document. This guidance clarifies the roles of parents, educators, and the schools. Goes on to say in the next paragraph, the virus that causes COVID-19 continues to evolve, and the tools to fight the virus have expanded. As new variants emerge, the epidemiology may change. Therefore, prevention strategies may need to be adjusted. We have seen that in Virginia Beach City Public Schools for 2 years. The next paragraph, mitigation strategies that reduce COVID-19 transmission can be reduced now that effective vaccines are available and the current predominant variant, Omicron, is causing less severe disease. Again, I am reading from the VDH document. Foundational prevention strategies in schools, such as testing and improving ventilation, combined with common sense actions of personal responsibility, such as staying home when sick, getting vaccinated, and hand washing can help reduce transmission in schools. Following public health recommendations to isolate at home after testing positive is also an important layer of safety for our school communities. For those who have tested positive or have been recommended to quarantine, wearing masks for the recommended time period and testing at appropriate intervals can help kids in school and keep everyone safe. As we proceed to the next page, this paragraph here, I'm going to read. This guidance provides details for local health and school officials and parents to inform their decision-making around COVID-19. It goes on to say mitigation efforts should be made in consultation with VDH and local health authorities. Please know, we meet every single day at 4 o'clock with our Virginia Beach City Public Schools health team, our senior leadership, and Dr. Bardati and her team at the Virginia Beach Department of Public Health. Every single day, Monday through Friday. And over the last several weeks, we've had some meetings on Saturday and Sunday. Next section goes on to talk about strategies to prevent transmission of COVID-19 in schools. And there are 5 factors that I included in some correspondence to parents. Parents didn't seem to be too thrilled about this correspondence, so let me go through this. Factors to guide decision-making about prevention strategies in school operations include, number 1, consult public health to understand local transmission and disease trends. We do that Monday through Friday with our health team. Number 2, understand community level vaccination coverage. We do that every Monday through Friday with our health team. Number 3, consider that level of impact to a school by identifying, monitoring, and reporting outbreaks to public health. This occurs daily. Number 4, understand community and school capacity and needs. Again, this occurs daily. Number 5, determine and implement a layered approach with multiple prevention strategies in consultation with VDH and the local health department. Again, we do that daily. The document goes on page 3 to talk about to consider the level of impact to a school, and it gives a new chart, similar to the old chart, but a new chart in terms of where you would fall. We have not had a conversation with our health department on where we think we fall on this chart, but I will give you my own thought. I would say we're in the medium category, because at this point in time, we have not had any cases that required us to close a classroom, close a grade level, or close a school. So I consider that to be sporadic outbreaks in schools. Sizes of outbreaks remain small. Our student absenteeism is slightly above the baseline, and our staff capacity is strained. It goes on to say in the paragraph underneath, beginning partially through, and again, I am reading from this document for those of you paying attention on TV. If the level of impact to a school is worsening, or if medium or high levels of transmission within a school are ongoing, and the circulating variant is causing more serious or severe illness, changes to current strategies may need to be considered. To inform these decisions, school officials should work with local health departments to assess and consider. I'm not going to go through this bulleted list, but we do this Monday through Friday at 4 o'clock with our health team. If we go on to the page 4 at the top, I think this particular paragraph is prudent. The very top of the page, the feasibility of certain prevention strategies, including any harmful impacts a strategy may have, should be assessed to help decide what combinations of strategies is best. For example, if a school cannot maintain operations while maintaining distances of 3 feet between students and classrooms, it would be especially important to focus on and layer other prevention strategies, such as testing programs, adequate or increased ventilation, ensuring appropriate hand hygiene opportunities, staying home when sick, supporting parents who choose to send their child to school with a mask, and regular cleaning and disinfecting. We have heard from many parents demanding 6 feet. We cannot open our schools and guarantee physical distancing of 6 feet. However, we have put an air purifier in every building. There are cleaning supplies in every classroom. The buildings are regularly cleaned. We encourage people to stay home when they're sick. We are taking every opportunity we can to meet other health mitigations. The next paragraph, because we've heard this before and this is very real. The needs of special populations within a school community, such as English learners, students who need special education or mental health services, or students who may not have reliable internet access at home, should be understood if a school needs to temporarily convert to virtual learning, or if individual students need to temporarily convert to virtual learning during necessary quarantine periods. Offering staff, students, and families the opportunity to ask questions and share concerns can provide meaningful input to help shape decisions of the right combination of prevention strategies. This is occurring. We have put out communication to our administrators around students with disabilities and 504s and convening those meetings when parents have concerns so we can determine the most appropriate mitigations. Let's go down to the prevention strategies. Remember, we started this presentation as a shared responsibility, parents, educators, school. So let's see what the prevention strategies are. For parents, keep your child home when sick. Vaccination. Masks. School officials. Let's go through each of these. Adequate and appropriate ventilation. Check. In all of our schools. Physical distancing, we will to the maximum extent practicable. But 6 feet within a classroom is not possible. We encourage students, teachers, and staff to stay home when sick and seek to take care and test if they can. We educate staff regarding these choices. Let's talk about the offer of the COVID-19 testing programs. How about this one? We ordered tests from the VDH in December to start our Binax testing program. You remember that? We got those within a few days, 2,000. We've run out of those for the most part. We ordered another set of 4,000 tests, roughly, on January 3rd. We don't have them yet. We ordered today another 4,000, hoping that maybe tomorrow we'd get the 4,000 that we ordered on January 3rd. So here is a listed mitigation strategy. You remember that bullet at the top that said the Commonwealth and school divisions? And I'm not throwing anybody on the bus, under the bus, but I certainly got run over this weekend multiple times, so I am sharing factual information. There are no tests that are coming to us. So to say we're going to offer a COVID-19 testing program outside of the VISTA testing program, which we're using for our athletes, which originally we'd get results back the next day, but now we're getting results back in 3 days, is an issue. Ensuring hand washing, respiratory etiquette, cleaning and maintaining healthy facilities. Notify students and staff of known cases or exposure in combination with isolation and quarantine. Again, the numbers we have seen over the last several weeks, and this is from the Virginia Beach Department of Health, you can talk to Dr. Badati, have required a modification to our contact tracing. Because contact tracing to the level we were able to do it earlier takes hours of work. And we have multiplied our staff, and they work in the same room at PDC, which is why we can't have some board meetings over there. They occupy 2/3 of that big, large meeting with our team and their team on contact tracing. We can't contact trace the way we were before. I know that doesn't make people happy. But the reality is what we are doing is we're letting people know if you were in a position in a building where there was a positive contact. Then we need that freedom requires responsibility to kick in. And that is the responsibility to monitor your symptoms. If you're sick, stay home. If you're sick and you need to go get tested, go get tested. If you can't get tested, we will try to provide something to you. And we'll continue to explore our options. But I need everybody to be aware of the situation that we've been placed in. And we are doing the very best we can. It also goes down to public health. And I will tell you, we are so fortunate from Dr. Welch to Dr. Badati. That Virginia Beach Department of Public Health team is exceptional. They do everything they possibly can, and every one of those bullets they meet. Let's talk about the last part, and I know I'm long-winded, but I think people need to hear this. Preventive actions. And I want you to notice the order of the preventive actions. The first preventive action, according to the Virginia Department of Health, is get vaccinated. The second prevention by the Virginia Beach Department of Health is stay home when you're sick and get tested if you can. The third preventive measure by the Virginia Beach Department of Health, physical distancing. So let's talk about that for a moment. Because Dr. Robertson just said we can't do 6 feet. In Virginia Beach City Public Schools, failing my kid. There are some things we do. In elementary school, you could say we cohort. Because those kids are together the entire day. We do close or stagger the use of communal spaces. Cafeteria is a communal space. We separate those kids at 6 feet wherever we can. We limit assemblies and other school gatherings. Yes, we do. And when we have events in the evening, we require people to wear face covering and distance. We limit non-essential interactions between teachers and staff. They Zoom. Our teachers are not seeing each other as well because we're keeping them separated. Number 4 from the VDH to prevent COVID spread. Prioritize disease investigation and our notification of disease to school community. On page 7, you see you cannot read this chart. This chart needs to be blown up and you look at it yourself, but it talks you through the matrix of what do you do if your child's ill or exposed. So I encourage parents to look at that. But I also want to note in this paragraph where it says, from the VDH, persons who are up to date with COVID-19 vaccines. Up to date means you have received your primary vaccinations and you've received a booster. Persons who are up to date with COVID-19 vaccinations do not need to quarantine. That is not Don Robertson's rule. That's not Dr. Spence's rule. That's not Ms. Rice's rule. That's the Virginia Department of Health. For others, CDC and VDH recommend people stay home for at least 5 days, get tested, or soon after 5 days if possible. A person can end quarantine after 5 days if they have no symptoms and can wear a mask when around others through day 10 after the last contact with someone with COVID-19. And VDH recommends a 10-day isolation or quarantine period for students who are not willing to wear a mask in schools on days 6 through 10 after quarantine or isolation. It goes on to say, number 5, on their prevention strategies, screening testing, we've already talked about the challenges there. Number 6, ventilation, we've already talked about, we have air purifiers in all the classrooms. When the temperature is above 45 degrees, Mr. Freeman, is that right? We try to crack the windows? Yes? Try to keep doors open to airflow. We're doing all those things. Number 7, implement hand hygiene and respiratory etiquette. We do that. Our buildings look great and they are clean. Number 8, clean and maintain healthy facilities. And number 9, mask as prevention. This document is available, and Ms. Donato, you can go to the next slide. This document is available to everyone on the Virginia Department of Health website, and I encourage you to take a look at that. Okay, so to ensure our schools are prepared to support the school board decision last week, Dr. Saltner and his team and Dossel immediately went to work drafting communications and plans for our principals and schools. And several of the things they did are listed on this slide. We provided frequently asked questions to assist principals with communications and potential stakeholder challenges, how to handle those. They conducted multiple principal check-ins over the weekend to support leadership in implementing change and ensuring compliance. Because we could anticipate how some may react when a student may come in without a mask. We worked with the Department of Teaching and Learning to develop resources based in schools' PBIS and SEL practices to proactively address potential issues of mask bullying and broader issues of respect and individual differences. And we responded at the central level, they did, to a myriad of parent and teacher emails. This slide presents an update on athletic testing at the high school level. Recall we initiated testing for winter sports because it added another layer of mitigation for our athletes as they moved indoors where transmission is higher for practice and competition. The regular season for winter athletes is scheduled to end on February 15th. We've got regional play beginning first with wrestling on February 5th and state play February 18th, wrestling, swim, and gymnastics. Our winter teams will continue to test. All varsity games that have been postponed to this point have been replayed, and we have had no postponed games for this week. And with the onset of spring sports, which begin February 21st, spring sports are outside, testing will discontinue. School release. Central Support continues to offer schools several measures of assistance to help schools open 5 days per week, and they include the first one, we continue to deploy Central Support staff to buildings as needed Monday through Friday. I am so proud to announce that today our staff absent rate was what it would have looked like in September or October or November. It was less than half of what it has been. Staff days on February 1st and March 14th will be unencumbered because we'll be ending the Wednesday early release days. Tomorrow is the last day. We have an adjusted dismissal April 8th. That's going to be unencumbered, and there will be a remote planning option for staff. And of course, all non-essential professional development remains paused. And then finally, since our last Thursday school board decision, 3 common requests have come from stakeholders, and I want to address each one here. We talked a little bit about this. The request to separate 6 feet masked students from unmasked students. Schools will physically distance to the maximum extent practicable. Teachers will not be separating students into groups according to wearing of a mask. That would be in a violation of Virginia Beach City Public Schools Policy 5.2 and 867. We've had a request for an immediate virtual option. And I shared with you earlier where Virtual Virginia is right now. Virginia Beach is collecting interest from families to determine the viability of offering more virtual options, and that survey, parents, closes on Thursday evening. So if you haven't responded and you're interested in that, you need to go back to that Friday communication and complete that survey. We've heard the request a remote option. I'm not going to send my child to school where there's kids unmasked. Schools are not going to be providing concurrent instruction to students at home. That is a burden we are not asking teachers to take on. And parents are required to comply with Virginia Code 22.1-254 compulsory attendance, as well as School Board Policy 517 and Regulation 517.1. At this point, we stand ready to answer any questions.
Okay, we'll begin with Mrs. Franklin. Thank you, Dr. Robertson.
Thank you, Dr. Robertson. I have two questions, one question and one statement. I did want to make sure that everybody knew that if you go to https://special.usps.com/test kits, every family can request 4 home test kits from USPS. I'm sure that it's already out there, but I just wanted to remind people that they can actually order that online. So please do that so you have some additional test kits as well. And I couldn't remember, if you could just clarify, on Thursday night, did we decide that in elementary schools that we would ask teachers to be able to get those statements from the parents and try to comply with that and keep up with that, or I can't remember?
So the way we proceeded is we asked parents to let us know of their intent
Sure.
to send their child to school without a mask. We had, as of today, about 5,700 out of 64,000 students, families respond. My concern is I don't want our teachers to be the mask police.
Okay. I
And
thought that
so
maybe we determined that in elementary school it was a little bit easier.
it is easier to know,
Okay.
but then we put the teacher again in a position where they're the mask police. We need our
Okay.
teachers to focus on
No,
what's most important, the
I
instructional
understand.
piece. So
Yeah, I understand. Okay, I wanted to make sure that I understood correctly, so, but, so right now that is.
So what we've communicated, Ms. Franklin, is that our principals have access to that through the student information system. If a teacher or a parent has a specific question, because I know that came up, that a parent might want to check, is my kid wearing a mask, or
Yes.
that they would need to contact school principal, and the teacher can talk with their principal and we can answer their
Okay.
questions.
That's kind of what I wanted to understand. Thank you.
All right for now, Mrs. Franklin? Okay, then Mrs. Hughes and Mrs. Manning.
I don't really have a question. I just wanted to thank you for clarifying the letter that went out, because we got a ton of emails and phone calls and text and messages as well. So I really do appreciate you clarifying that for people.
Oh, sorry. So, great feedback from the principal letter that went out. I've gotten a lot of messages from parents that they felt that it was very kind and supportive of all students. So I just want to give kudos to you for that communication. Can you go back to page 10 of the VDH document? It's actually item number 9, masks as prevention. I appreciate you bringing this document to our attention. I reviewed it earlier today, and I want to highlight something. This is from the Virginia Department of Health and their guidance to us. Masks made of plain cloth, masks that are soiled or poorly fitting, and masks that are not worn properly provide reduced or no benefit. Mask wearing may cause discomfort, skin irritation, anxiety, and otherwise impact a child's emotional state. Children may have difficulty communicating, perceiving emotion, or making social connections when wearing masks. During the Omicron outbreak, regions with restrictive masking policies and practices have shown similar rates of transmission as regions with less restrictive mask policies. So this is what I've been saying for months and months, and now it's in our Virginia Department of Health guidance. And I want to also point out that a lot of people are pointing to this Senate Bill 1303, which is actually, if you're referencing the law, it's actually Chapter 456 of the Administrative Code. That says follow CDC guidelines to the maximum extent practicable. And, you know, we know that that's a gray area. But if we're following the CDC guidance for K-12 education, which is referenced in Chapter 456, it says here, in that document, the CDC guidance is meant to supplement, not replace, any federal, state, tribal, local, territorial health and safety laws, rules, and regulations with which schools must comply. The adoption and implementation of this guidance should be done in collaboration with regulatory agencies and state, tribal, local, and territorial public health departments and in compliance with state and local policies and practices. So if, for those who do believe that Chapter 46 is governing what we do with masks, Chapter 456 references CDC guidelines. CDC guidelines says follow your local health department guidelines. And our local Department of Health guidelines say that masks provide no benefit, basically, is what they said. Thank you.
Mrs. Anderson.
Can you talk about a little bit about what has happened today, what happened today in our schools? Give us a rundown of how it went.
Yep, sure. So today, Dr. Saltner and his entire team, which includes Matt Delaney, Jim Smith, Sterling White, Linda Hayes, as well as Dr. Spence and I went out to schools. And so I can only speak, and I can have Dr. Saltner come up and share a summary of what he saw. I can only speak to what Dr. Spence and I saw. We went to Green Run High School, and there we saw Green Run High School and GRC. We went to Kellum High School, went to North Landing Elementary School, and Princess Anne Middle School. From each of the principals, we heard that the majority of students, the high majority of students in some schools, were wearing a mask still. We heard from some teachers who had expressed concerns to their principals that they were going to be really anxious. And so we personally made a visit with the principal to those classrooms to ask, hey, how are you doing? And one particular teacher who was really anxious in the classroom were two students unmasked. She was fine, and those students were one was sitting at a table with two masked students. They were doing a group activity together. They didn't care that one was masked and two were not masked. They were kids, being kids, learning. So from what I saw, and Dr. Saltner, if you want to come up here and share, you can. We felt like today went exceedingly well in our schools.
I can only add ditto to what you have heard. Dr. Smith and I spoke to principals. They found that the anxiousness of many of our teachers abated quickly when they saw the volume of students who were wearing masks. Dr. Smith and I attempted at Lansdowne Middle School to observe several class changes. We were hard-pressed to find a student without masks. As we visited Princess Anne Middle, there were fewer not wearing masks, but the great majority, and I would need to tell you from my visual assessment, probably 80% or more of the students are wearing masks. So our teachers, I think, felt some comfort from that, and our parents are exercising what they believe in terms of mask wearing. But all in all, it was situation normal from a perspective of a distant observer. I know that our principals and our teachers certainly had apprehensions, but I think today was a reassuring day to show them that the majority of students there are indeed masked and that they are respecting the rights of those others.
Thank you.
Mrs. Weems.
Thank you, and yes, thank you for clarifying that letter, Dr. Robertson, and going into such great detail. Very interesting, new guidance from the Virginia Department of Health, in light of all this. But I just want to thank you too for standing firm on having, no separation of masked versus unmasked students. It was pretty horrifying to see on the news, different school divisions that had used that separation, and I was just so hopeful and praying that we would not go there, so I really do appreciate that. I think the letter and the telephone call from the principals, Dr. Spence, was just, or Natalie, or I don't know who to thank, or if they were all the same, but the one that we got from our principal at Hermitage was just very, I mean, just excellent. Just basically saying, be kind and respect people's choices. And we know the kids don't have any problem doing this, but unfortunately, adults get in the way. And we've seen this in our emails, whatever side that we voted on. You know, adults, let's take lessons from our children this week. And I think that would be just a great lesson in itself. Watch the kids and take lessons from them, and we'll all be okay. So again, just thank you. From what I heard from my granddaughter, everything was pretty smooth sailing, and people that got the choice of not wearing masks were excited, and those that got the choice were comforted. So I think I agree that it went really well. Thank you.
Ms. Owens?
Thank you. I do have a couple of different questions in regards to our update. In terms of the absenteeism, I know that we reported that we're slightly above baseline. It would be helpful if I could have some kind of an idea of what that means. What percentage is baseline, what's slightly above, and what do we consider high?
So our daily attendance is almost 90%. Now, there have been days previously where our attendance was in the mid-80s. It also fluctuates by the school, not surprising. There are some schools that hover in the 90s, some schools that hover in the 80s. So we did not deem the attendance that we've seen as anything out of the ordinary. It's similar to what we would see during flu season.
Okay, so percentage-wise, are we thinking we're looking at that as a district, a whole district, what the absenteeism is? Or are we saying that there are some schools that are high and some that are above baseline? What does that mean?
Mrs. Owens, on a daily basis, Dr. Smith, Mr. Delaney, and Mr. Sterling and Ms. Hayes receive a report first thing in the morning. They examine the attendance for each school. In addition to examining that, picking up the phone where there are issues or where they see concerns, we are working with our health team where we have classrooms with excessive absences, and our health team is looking at the data to see what trends are there and to see if there is transmission occurring in the classrooms. As you know, I think we've only closed 2 classrooms this year, and we've had no reason or no data to suggest otherwise. But in our daily meetings, attendance is an agenda item. So we're looking at it daily, both in the morning and then again as a team when we're with the Virginia Beach Department of Public Health.
Okay. And I appreciate that, but what I'm asking is, do we actually have percent numbers that qualify what those categories are? I mean, if it's no, it's okay, but is there a percentage that we say, if there are more than 15% absent, then this is medium, if there are more than 35%, this is high? Is there an actual category?
No,
that
there are
gives us those?
no barometers for that. We recognize what schools typically have high attendance. They generally reflect your higher demographics, which schools have low, and they reflect generally your lower demographic. When we are aware of these, and the folks who are reviewing these are aware of where schools typically sit, they use that knowledge to address those areas that they have concern. We have not had any concern areas with attendance based on we are certainly below where we would be in a normal year, but it is right in alignment with our attendance from when we were in school with COVID, and as Dr. Robertson said, during if we were to have flu season.
Okay. It would be nice if we could have what that would look like for different schools, just so that we're all on the same page of what's being looked at.
I can provide that to you.
Okay,
Thank
thank you. I have a question just about mitigations in I know we said we're limiting assemblies and school gatherings. I know that we have district chorus coming up, and I'm just curious how those activities are handled in terms of mitigations.
We, with our mitigations, are shifting based on the masking that we have when our students are in chorus during the classroom. They are not required to be masked at this point.
Okay.
That option changed with the executive order. With our competitions, it depends on the actual event. We had a regional one-act play where we allowed our performers to be unmasked, to be in alignment with the rest of the region. So for the most part, our activities, unless our students are athletically engaged, our students are masked when they are not actively participating.
Okay, and I don't know if we've looked specifically at district chorus yet. I know that that has students coming from multiple different schools who are not normally cohorted together on a team or in a classroom, coming together in groups of, 70 plus to then mask. And so I'm just making sure that I understand what it is that we're doing, whatever the policy is, just so that we're transparent and we, parents and community, can make decisions based on knowing what the plan is.
And Ms. Owens, we are making those decisions based on each individual event. There are some events that draw very few spectators, and we don't have to limit capacity. We do ask everyone to be masked. We do encourage social distancing. Families, however, do sit together.
Sure.
But it depends on the actual event. For example, a swimming event in a confined recreation center, we've got to restrict significantly capacity for adults to watch. So it depends on each individual event that we're making our decisions. And they're being made by a team of individuals from our Student Activities Office, as well as with Dr. Smith and Mr. Delaney, who oversee the middle and high school, and Mr. McGee.
Okay. And when you guys find out how you're going to handle the district chorus, if you could just give me an email so that I'll be in the know, because that's the one that I'm specifically
Can do.
interested in right now. Okay. In terms of the I just want to make sure I'm clear with the not policing, because we kind of talked about in elementary schools having teachers be able to know and say, up, Johnny, are you supposed to have your mask on, and reinforcing that. And now that we're not having that as a situation that will happen, I want to make sure that parents in the community are clear so that they're, again, making informed decisions about what's going on. So staff will not ask a child to mask in general. They're not going to police. That's going to be something
That
that
is
happens
correct.
at the home happening. With not asking the child to mask, I assume staff is not going to be documenting or keeping track of who's masked or who's not masked.
They will not. They have access to recognizing who has an opt-out option, but we have asked them specifically not to enforce, to focus on instruction.
And so they have no reason to look and say, Johnny is supposed to be masked or not supposed to be masked, but we'll go with whatever is in parent view, whatever the parent has indicated.
And I would say they do have a reason, Ms. Owens. Sometimes a parent may consult or call the teacher and ask, is my child masked? And they might check to see if they've indeed opted or completed that opt, and they will make the parent aware. They can't report on a daily basis. They
Sure.
could not keep up with that. But if a parent were to consult, a teacher will certainly work with that parent to confirm or deny.
Okay. And then in terms of the document that Dr. Robertson went over with us, I know on page 6, it again goes over the definition of a close contact. And I know we mentioned last time that without the masking, close contact is going to be different. People within that 3 to 6 feet, if either of them are unmasked, are now considered a close contact. But since we're not policing it, we're not going to know who's actually a close contact, is that correct?
I'm going to go ahead and let Dr. Padati from the Virginia Beach Department of Public Health, who is online, respond to that contact tracing question.
Thank
If you need additional information, I'll enrich that response.
Yeah, thank you so much. Can you hear me all right?
Yes.
So you're absolutely right. The definition or the way that we think about close contact, if you're now not wearing a mask and within that sort of longer distance of 6 feet, that would be something we would consider close contact. But you're also right that it might not be possible to know all of that down to an individual level, particularly right now with the case activity being as high as it is. And I understand that can be a little bit challenging, but I also think it's part of when you take a step back, and I think I've kind of talked about this before, it's part of what we think about when we look at all the public health tools available to us to help manage a virus like this and how they've changed over time. So what you're seeing, and I know changes and new things are hard, but part of what you're seeing is increasingly the acknowledgement that we're not in the same situation we were 2 years ago, thankfully, right? And so while we do still think that there's risk, there's always risk, it doesn't go to zero, we're able to bring that down with things like vaccine in particular, and of course masks and staying home when you're sick.
And just for clarification, we're able to bring that down with masks, mask use. I mean, when we're talking about that, bringing it down, if one person has a mask in the room, does that bring it down for that one person if the others aren't masked?
Yeah, so again, a good way to think about this, I'm sure you've all heard sort of the analogy with safety in a car, right? So wearing a seatbelt, having brakes, having an airbag. So in public health, we always want to be on the preventive side. So that means vaccination and taking advantage of that, as well as the boosters, to really make sure your immune system knows what it's doing before it's ever exposed. And then adding in things like wearing a mask, which absolutely does help protect both the wearer and the other people in the room. Because again, if you think about even pre-COVID times, we used to say stuff like, please cover your cough. That's really what we're talking about here, right? Is covering to prevent those aerosols. And in fact, a lot of the things that Dr. Robertson outlined in that VDH guidance, they help with other viruses too, which is a good thing.
Mrs. Owens, thank you, Dr. Padati. We are blessed to have that relationship with the Virginia Beach Department of Public Health and you joining us on a daily basis. We certainly value their contributions to the safety in our schools. Do know that we are contact tracing with our athletic teams, and we have that ability.
Okay, it is good that we are able to do it at some level, and hopefully that we'll be able to get closer to doing that as numbers improve. It is still certainly concerning that we can't do it at this point, and that
It is capacity, and we have not stopped. We have modified, and it is a temporary modification.
okay, that's all I have for right now. Thank you.
Thank you.
Mrs. Weems? Okay. So can we, I guess I'll just offer these comments. The Virginia Department of Health and Dr. Padati have both acknowledged the role of masks, and the level of acknowledgement, may not satisfy everybody, but I think that needs to be said. I want to personally thank the families and students, based on feedback from today, who do recognize that we're all in this together. And we'll be looking forward to feedback, from the rest of the week, because this was the first day. And just can't emphasize enough how we will continue to, you've stated so clearly how closely we're monitoring this data. And so for those with anxiety, I think it can't be emphasized enough that this is a continuous monitor process. Dr. Robertson,
Yes, ma'am.
seems like you want to share
Yes, ma'am. I got
something.
one more thing to add. We've been applauded by the Virginia Beach Department of Public Health for over a year, started prior to Dr. Welch, because we've taken a strategic approach to whether we add or remove layered mitigation. Every single time we have put in a period of time. We have had a defined period of time to monitor and assess any changes we made, because that has allowed us to take data as a result of the change and use that data to determine whether or not our change accomplished what we wanted it to accomplish. Due to the snow, we've only had 1 day back today. And of course, the meeting was just last Thursday. So I would encourage us to continue to be strategic and allow time to determine whether or not what we have done is going to accomplish what we hope for.
Ms. Owens and Mrs. Anderson.
Yep, I just remembered my other question, and it's in regards to the absenteeism again. The way that absences are being counted, is that a universal kind of district-wide policy? I'm hearing that some schools, if you are logging onto your Chromebook, even if you're not present, but you're doing the work, that you're being able to be counted present versus other schools where you're not being counted present, and how is that affecting how we're looking at absenteeism?
All schools are following a division policy. If a student accesses their work while out in isolation or quarantine or for extended illness of any type, they are being counted present once they access that work. So initially, we grab the data to know who's absent. So teachers are marking everyone absent. That gives us a percentage that we know for the classroom. We go back as soon as the work is submitted and make those adjustments. So the best opportunity for us to grab real data is on the day of the actual recorded absence, or actually the next morning. But we are going back, and all schools should be marking those students present who access that work.
Great, thank you for clarifying that, because I think that's been a question, and thank you for clarifying that those absences are being pulled prior to look at, and then adjusted for. Thank you.
Go ahead, Mrs. Anderson.
So I realized that today was the first day. And so it sounds like, from what I've been told, and everybody who's visited schools today indicated that the majority of students were still masked by their choice, I guess I'm hoping it's by their parents' choice, not by the students' choice, but anyway. But I'm anxious to hear, in 2 weeks, I'll be anxious to hear again if that remains, the same level of student masking is still continuing, or if, it's just dropping off.
We'll include that in our update.
Hopefully, we will finally get a day when we don't have to have a COVID update. That's what we're hoping for. We're all hoping to get back to normal. We have been from day one when this all started. But, hopefully, I'd like to know that as long as there is an outbreak out there, that students will continue to monitor themselves, and parents will continue to have their children be safe at school.
We have made a commitment, Ms. Anderson, to be out and in the buildings this week and next, and we will certainly add that to our COVID update at our next meeting.
Thank you.
All right, there's no one else in the queue. We do have a few other topics, but one last call right now, ladies. Okay, then, we will move on to middle school scheduling. And we welcome Dr. Smith, our middle school director.
Good evening, Madam Chairman Rye, Vice Chairman Melnick, Dr. Spence, and members of the school board. This evening, I would like to present a schedule option which addresses some of our staffing challenges by examining how we can better maximize our middle school schedule. At the January 11th school board meeting, Human Resources shared this slide that is on the screen right before you. I have duplicated this to remind us of the tremendous staffing issues facing schools at both the national and local levels. While Ms. Woodhouse and her team shared recruitment efforts, these efforts have not yielded the results we hoped for, and the forecast for recruitment remains a challenge despite the many efforts and good work of our Human Resources Department. To put the teacher shortage in perspective, let's compare our instructional vacancies from August, when teachers returned, to the vacancies we have today. Despite our best efforts at the school and division levels, we continue to be challenged by vacancies we cannot fill. At the middle school level, we began the year with 14 vacancies, and despite filling many vacancies throughout the school year, today 18 instructional vacancies remain. When combining vacancies at the elementary and secondary level, you will notice we started the school year with 113 vacancies and currently have 116. These numbers signal to us that we must be forward-thinking and seek solutions if we are to continue to provide daily exceptional educational experiences for all VBCPS students. To that end, a committee of middle school principals, assistant principals, teachers, along with central administration leadership, were challenged with finding a solution that addresses Goal 6 of Compass to 2025, maximizing human resources, in particular, how we might better assign staff to a middle school model. Let's look at the current schedule predominantly used in middle schools. This current schedule utilizes a hybrid A-B block schedule, meaning core classes meet every other day. Students take 2 elective classes, which meet daily, much like the traditional junior high school model. On this schedule, our core teachers currently teach 4 core classes over 2 days. Our elective teachers teach 5 daily elective classes. In addition to their 4 core classes, our core teachers are also provided time for collaborative planning and providing remediation to struggling learners. Some schools do use a traditional bell schedule, where, like this schedule, teachers teach 4 core classes. Before we look at the committee solution, know that teachers and principals find this schedule to be effective. However, staffing has become increasingly difficult, as previously shared, and we must look at alternative schedules that maximize teacher capacity and addresses our teacher shortage. This schedule has the potential to maximize our staffing by a projected 70+ instructional positions, while also positively impacting high school and elementary levels. For this reason, I am bringing forth an alternate for your discussion and feedback. In developing a solution to our staffing challenges, the committee worked with the following parameters. First, we looked at how we can maximize our existing staffing. Next, we ensured our model included the minimum 250 minutes of weekly planning, which meets the requirements outlined in Regulation 4-60.1. Lastly, we ensured this model, like our current model, protects our academic support bells, which allows valuable time for teachers to work with struggling learners and to meet their needs. After multiple meetings of brainstorming, creative solutioning, active debate, and analysis, the committee arrived at a consensus on a model I wish to discuss with you this evening. Looking at the schedule before you, you will see that grades 6 and 7 operate on what many would consider a traditional bell schedule, much like a junior high school model. You will also see that grade 8 remains on a hybrid bell and block schedule. Like our elective teachers in our current model, our core teachers will also teach 5 bells, which is an additional core class for each teacher. I would like to point out the lunch schedule, which allows for 2 6th grade lunches, 2 7th grade lunches, and 4 8th grade lunches. The rationale for this is to ensure that we do not exceed cafeteria seating capacity. For example, while the first half of 7th grade students have lunch, a quarter of our 8th grade students will join. This will also happen and repeat for each lunch thereafter. I will break it down to you now by sharing examples of what a teacher and student schedule might look like. On this slide is an example of a 6th grade teacher and student schedule. Looking at the teacher schedule, you will notice each teacher teaches 5 bells. In this example, the teacher will teach 4 bells of Math 6, followed by a 30-minute lunch and a 55-minute planning bell. The teacher will end the day with 1 bell of Math 8 for a total of 5 core classes. Looking at the student schedule, you will notice the student has 4 core classes, beginning with Math 6 Bell 1 and ending with Science 6 Bell 4. The student will then have a 30-minute lunch, followed by 2 elective bells, which in this example are Health and Physical Education and Art. In this schedule, students will attend all 6 classes daily. As well, the same schedule will be used and followed by our 7th grade teachers and students. On this slide is an example of an 8th grade teacher and student hybrid schedule. Looking at the teacher schedule, you will notice each teacher teaches 5 bells, just like 7th and 8th grade, and each will have planning for 55 minutes. Elective bells, which are on an AB schedule, will be 115 minutes. What makes this schedule different from grades 7 and 8 can be seen in the center blocks where AB schedule exists for 8th grade elective classes only. As previously discussed, it would allow for 4 8th grade lunch bells to ensure we do not exceed seating capacity in our cafeterias. The teacher will start the day with 2 bells of English 8, followed by 1 bell of English 6. The teacher will then have a planning bell, followed by a 30-minute lunch. The teacher will conclude the day with 2 English 8 classes. Looking at the student schedule, the student will have English and Algebra daily, bells 1 and 2. Next, the student will have Avid 8 on an A day and Band on a B day, followed by a 30-minute lunch, and ending the day with Earth Science and Civics, which will meet daily. On this slide is an example of a hybrid schedule for an elective teacher and 8th grade student. The elective teacher will teach 6th and 7th grade electives on a daily 55-minute bell, while 8th grade elective classes will be on an AB schedule, which meets every other day for 115 minutes. In this example, the teacher will teach 2 daily bells of Avid 7, followed by an Avid 8 class on an A day and an Avid 8 class on a B day. The teacher will have a 30-minute daily lunch and a 55-minute daily planning. The teacher will end the day with an Avid 6 bell, which meets daily. The student schedule is the same schedule presented on the previous slide. With the implementation of this schedule, we are confident that we can address Goal 6 of Compass of 2025 by maximizing our staff with the addition of a 5th core class within the confines of the same teacher contractual day, while also providing 275 minutes of weekly planning for core and elective teachers, academic supports to address student needs, and alignment in the middle school schedule across the division to better align our distant learning schedule. The model also provides, in most instances, common planning time for collaboration, except where a teacher is teaching a singular subject off grade level. This exception is not particularly challenging, as our formal model allowed teachers to teach courses across grade levels. These teachers successfully were able to carve out time to meet with peers in their corresponding subjects. We firmly believe that creating this model, which benefits our students while maximizing our staff capacity during this challenging staffing landscape. At this time, I'd be happy to answer any questions you may have.
All right, we'll start with Mrs. Riggs, our former middle school teacher.
You knew you'd get a question from me, didn't you?
I predicted.
Well, of course. I want to look at the hybrid schedule, or any of them. So are the middle school teachers currently teaching 2 different grade levels?
In most instances, no, but there are situations in your smaller schools where because of staffing, they have to.
So some of them have been doing that.
Some of them have done it. For example, in a smaller school, it's harder to staff. And with the staffing numbers, we have had teachers that teach cross grade level.
Okay, so what this is doing, giving them a different grade level to teach, is adding more preparation to their schedules.
Correct.
And we're looking at this new scheduling because of our ability to hire teachers and losing teachers, right?
Correct. We as previously mentioned in one of the slides, we currently, as of the time this was put together, have 116 vacancies.
Okay.
So if we're able to eliminate some of that, what we would be able to do is we would help elementary and middle because teachers would still be able to teach to their endorsement. So there could be a chance for a teacher to go to elementary school or high school.
Okay. All right, thank you.
Mrs. Anderson, then Mrs. Manning.
So basically, we're kind of being forced to do this because of lack of teachers. Would you say that is correct?
I just brought it here.
We're not being forced to do it. We're bringing it forward as an opportunity for us to have some discussion.
Okay.
You remember we talked about this before.
We did.
A little bit different scheduling model, really driven by a budget conversation. This was several years ago now. And, we tabled it at that time. And you heard Mr. Smith say right out of the gate, look, we like our schedule the way it is. It's a good schedule. It's a good schedule for our teachers. It helps us with academic intervention for students. So it isn't a question of we don't like the schedule and we think we need to change it for change's sake. We do have a significant staffing issue. Quite candidly, we're not projecting a change in our staffing issue moving forward. We've been having this conversation with you all for a long time that the numbers of candidates in our teacher prep programs is declining across the country. Good news was it actually went up in Virginia last year, which was good, and I think was a result of some work that was done at the state level to create 4-year programs again for education. That said, there still aren't nearly enough candidates to fill all the vacancies that exist in the state. So we continue to be concerned. And then that's compounded by the pay issues that we all are well aware of. It's compounded by what's gone on in the last 2 years and sort of what's been hung on our teachers and some of that. And so we've got some issues. We're going to work really hard. Our HR team, as you have heard over and over again, it does an exceptional job of beating the bushes and finding people and going out and getting the really high caliber talent that we need in Virginia Beach. So it isn't a function of effort. But we have some concern that we have maintained at 100 from the beginning of the year until now. That's atypical for Virginia Beach. It's happening across the region. It's happening across the state and it's happening across the country. And we're wondering, is this a long-term trend? We don't know, but we have some concern. So one of the things that we need to do as a prudent measure is have a conversation with you all about ways we might be able to, without significantly adjusting class size, because I think all of you understand one way to handle staffing shortages is you adjust class size up. But without doing that, another way you might handle that is a shift in the middle school schedule, because there's the opportunity, the biggest opportunity for us to capture staffing.
So my next question has to do with, if this were in place now, would we be, how would that affect how many teachers we're short? I mean, would we be saying we're 118 teachers short now if we had this particular schedule in place currently? How will that affect, we're still going to be short teachers, but
Right.
how is that going to help? Is it because teachers at that, in this middle school level will be covering more classes? Is that
Correct.
correct?
We-
5 core classes instead of 4 that they currently have? Okay.
Correct.
That makes sense. Now I'm seeing the picture. Thank you. I was a little dense on that one, but
No.
it's coming across now. So 5 core classes instead of 4 means that they're basically going to be covering more core classes.
Correct.
Thank you.
But you did add, I mean, to me, it's a broader impact when you said that a certain element of these middle school teachers will be placed elsewhere at the elementary and high school level. This isn't just about fixing the numbers at the middle school level, because we have 18, we're 18 short at middle school. That's one teacher a school and then some. So I figured there had to be more to this piece, and so I'll wait till the others two on the queue, but I'd like to hear a little more about how that process might unfold about, I'm sure discussions with teachers, right, who's interested in a different level, whether your endorsement is elementary or high school. Did I misunderstand any of that?
No, you didn't. If we're looking at a schedule such as this model, it would be a soft 70. We would have to, every schedule, every school is different. But yeah, so some of that may be through attrition. You have schools that go through attrition when they're in the process of doing the priority and looking at their staffing for next year. But we do have teachers that can teach elementary to middle and middle to high. So yeah, it's looking at a broad picture across elementary, middle, and high.
So there is a potential broader relief to this picture beyond the middle school level.
There is.
Okay, Mrs. Manning.
Yeah, so that was a little bit of my question. I think you estimated about 70 positions this would open up?
Yes, ma'am.
Okay, and certifications of teachers, is it K-6 certified? How are they certified, remind me?
So it runs a gamut. HR has all the different knowledge on certifications,
Okay.
but typically you do see K-6. In this case, in looking at this, we only have 22 teachers that fall in that particular category.
Okay, so this is, that 70 number, you kind of looked at who's certified at what and where they could be placed.
No, but I did look at the certifications for teachers that could teach K-6, and that's 24. This was simply looking at the staff and figuring out and building a schedule with
Okay.
adding a fifth bell to teachers.
Okay, and what, are you proposing that this would go into effect next school year?
Well, we brought it for discussion, yes. So it would be something that we would move forward with for next school year.
Yeah, I mean, I know in the past, when we brought this up a few years ago, it wasn't well received, but we're in a different place right now. I mean, to be able to impact those numbers at the elementary and middle school, and give those teachers and students some relief at those levels would be huge. So
Yeah.
it's something that I'm definitely open to. Thank you.
I think in that scenario, we were able to find the cost savings that we were looking for elsewhere, but, you know, we're in a position of whether or not we'll be able to find the staffing elsewhere is. And unfortunately for us, from a timing perspective, as we build out our schedules and try to understand what staffing that we need, is we don't really know what that's gonna look like. We can't really start the hiring process in earnest until late February, March timeframe, and that's when we really start in earnest. So hard for us to really know what the complete staffing picture is going to look like for us by the time we get around to having made this decision.
Mrs. Riggs, are you intended to be back in the queue? Yes.
Yes, if no one else is.
You go ahead.
So we're just talking about this right now. Okay. Do you not think this is gonna cause even more people to leave? I mean, let's face it. You're putting more on teachers now by doing this. So, and then going to be putting people in grade levels that they really aren't comfortable to be in, even though they're certified, because that's where you need them. So just a thought. I'm sure you have all thought about it, but that concerns me as well. So, I mean, and I know we're in, we're in between a rock and a hard place,
And Mr.
like
Hicks,
everything else this year.
we are looking for you to discuss it just as you have. We appreciate the pros, we appreciate the cons. Change is an uncomfortable process. I do want to point out, if you were to look at alignment with our secondary schools between middle and high school, the middle school model has allowed our teachers to teach, our core teachers to teach 4 classes. Our elective teachers do teach 5. At the high school, our teachers teach 6 classes.
Right.
So I did want to put that in perspective for you.
Right.
It's a fair concern too, Ms. Riggs, and I wonder, Jim or Jean, if you all could talk a little bit about because you didn't make this decision in isolation. You've been working with some folks about that. Could you just talk about some of their thoughts around the challenges?
Correct.
and-
Worked with the group of middle school principals, assistant principals, and teachers. We looked and analyzed. We met for 2 days, about 7 hours each day. Looked at all kinds of different models of schedules. Some of those schedules required things that we just didn't think. For example, extending the school day, not an option. And after a consensus, it was a consensus. It was a group that came up with, we feel that this model, given the circumstances that we're in, would best fit our middle schools. And all in that group did recognize that we're facing a teacher shortage. We have principals that have had vacancies for a while and unable to staff them. And not for a lack of not trying, just finding candidates has become increasingly difficult.
May I go ahead and we can come back to you?
I'm finished. You're
Yes,
good.
You stole my thunder a little bit, but maybe, and my parents with our secondary backgrounds, so let me go in no particular order. Do you envision with this proposal, would a teacher's total student, and I hate to use the word load, I don't know what a better term is, but the total number of students, how would how do you see that comparing with the average number of students our core high school teachers are teaching?
So typically a class is anywhere between 28 and 30 in the middle school. It would add, where you have a caseload of about 112 to 116.
Oh, I understand it's going to add for the middle, but how does their total new caseload compare with the present average caseload of a
With
high
the
school teacher?
It would be about the same. We wouldn't go over 150.
Or if the same policies are in place for the, we hope, rare cases when it does in terms of compensation?
Correct.
So in terms of accreditation, yes, personal accreditation. So K to 6 was mentioned. Is it still, I mean, I'm dating myself, but is it still common to have middle and high school certification combined? That a number of our middle school teachers would also be certified to teach high school?
It is. I mean, we have teachers that teach algebra certified.
Okay, it was
or
just the
science.
focus was more on like who's eligible to teach elementary. Just want to make clear we have other teachers who are eligible to teach high school.
We
I
do.
mean, my mother was one who started at the middle school level with math, and after 6 years or so, wound up, 24 more years in high school, so, yeah. Okay, Mrs. Franklin and then Mrs. Riggs again. Okay, Mrs. Riggs.
I can't remember, so please reiterate this. So would the middle school teachers still have remediation?
They would. So where a teacher picks up a 5th class, so if I'm teaching 4 bells of math 6 and 1 bell of math 8, I am not doing a remediation. So if you have a teacher where I'm teaching 4 bells of math 6, I might pick up an academic support bell, which in which in 6th grade helps because the teacher has that endorsement and will stay on that grade level.
So it's a trade-off.
Correct. So there will be academic support, and it will be a model that's used.
So I want to point that out. I don't know how much academic support they do in the high schools. But, you know, you're trying to compare the high school classes and how many they have compared to the middle school. But you also have the middle school that is teaching that academic, and that is a class too that they teach. So that is equal to that because they do academic support. And I remember having as many academic support students in my class as any regular class. So it is, they're not getting off. So I just want to point that out, that I do know that, and all our middle school teachers know that as well. So thank you.
So to clarify for my benefit and maybe others again, so this academic, this is a set of class you're speaking about, not like a study hall.
Correct. It's for
Just
students.
just to elaborate a little further on the middle school concept in this class that Mrs. Riggs mentioned.
Yeah, currently we have in process, and we've had it, where if a student isn't meeting with success in Math 6 at the end of the 9-week course, then they're placed in an academic support lab where they get additional help. It's like having an extra bell of math.
And you're saying that would constitute a teacher's 5th class potential?
It would.
Okay, I know, I mean, I think that's a revelation to me, so thank you for that question. Okay.
Only if they were teaching another grade level. Okay?
No.
I mean, what I'm saying is they would not have the academic support class if they had 8th grade English for 4 bells and then the 6th grade English. They would not. So that's the trade-off.
Correct.
So the
It would
teachers that
count as
have
a fifth
all
bell.
6th grade would have that academic support. So,
Thank you.
yes.
Okay.
Oh, and by the way, there is ultimate planning with the remediation classes and collaboration with other teachers that they do it together and they work as a teacher for a separate class and do planning for that. So it's not a study bell at all.
And my final question, the planning time here, how does that compare with high school planning time?
So it's roughly the same. We would have 275 minutes that would happen each week for the middle schools.
And what's the high school presently, Mr.?
As Dr. Smith shared, it's roughly the same. It's sometimes challenging to give you an exact number there because there's other things that occur for a teacher that could be a duty or so forth, but they all reach the guidelines that are required. Probably, I would estimate we get a little more on the high school level, but to Ms. Riggs' point, we do have teachers that teach an academic support block in high school as well. It's not a study block in all instances in those cases, so you do have some similarities there.
Thank you.
Sure.
Anything else at this time? Is it fair to comment that any of my colleagues can follow up with you this week or next before the next meeting with questions?
Yeah, absolutely. What I was going to say was, again, the model we have, it works. Given the situation we're in with the teacher shortage, that's the purpose, was discussed earlier. And you could reach out to me, and next meeting I will come back for your input.
And can you just share in terms of the teachers and where they're at in this communication chain at the moment, and if there'll be opportunities for them with their principals have those discussions already started? You said that there was a stakeholder group that included teachers, right?
Correct.
So what about the broader
broader-
population? So that just the same channels for them if they want to reach out with questions or feedback, right?
Correct. So this has been shared with that committee and has been shared with the principals. So we didn't broadly present it because we were bringing it here for information and discussion.
Okay, everybody? Thank you.
Thank you.
And our final workshop topic for today, welcome Mr. Den, School Board Communications.
Good afternoon, everyone. Good afternoon, Ms. Rye, board members, Dr. Spence. I have the pleasure of giving what will likely be the shortest presentation that you will have in in our sessions. So I'm here to provide some details on how we'll be modernizing and improving our security around school board communication technology today. This includes how the public communicates with the school board and how the school board communicates with each other and with staff. All right. So first and most significantly, we will be removing the Google Group email address and replacing it with web forms on the vbschools.com website. The forms will look very similar to the picture shown on the slide. They will be easily accessible from a computer or from a smartphone and will allow the public to send a message to the entire school board or to an individual member. When a member of the public completes the form contents will be sent to the board as an email. The board can then at that point respond to the email as you normally would. Using a form instead of an email address eliminates the possibility of security issues commonly associated with email addresses. So for example, a group email address that you have today can be associated to subscriptions or mailing lists. Forms cannot. Using a form will also allow board members to categorize messages from the public in their Outlook email boxes. For example, all messages from the public regarding the budget can be categorized and separated from messages about other topics. Automatic responses would also be set up to provide the public a confirmation that their submission, that their message has been received by the school board. If you'd like to see an example of how this is being used in another school division today or whenever you would like, you can check out the Prince William County Public Schools school board page at the address that is on the slide. Second, there will be a new group email address for board members to communicate with each other in the same way that you do today with the Google Group email address. That address, as shown on the slide, will be schoolboard@vbcpsboard.com. Unlike the current group email address, this group email address will only work for school employees and board members inside the VB Schools email system. It will not receive emails from the public. Holding true to how I started this, we're already at the summary. So, trying to summarize these two main topics and open it up for questions. The messages from the public to board members must be submitted via forms at vbschools.com. The Google Group email address will be removed. It will be replaced with a new group email address for internal messages only. All other communication technology that you currently use will remain the same. If there are no objections, we would like to make these changes by the end of the day on February the 11th. We will, of course, send a reminder email to the board prior to the change to make sure that everyone is aware when things happen. One of the other things that we will do is we'll set up an automatic response on the current Google Group email address so that if the public happens to use that in the future, they will automatically get a response letting them know that the board does not receive messages using this email address anymore, and they need to go to the vbschools.com website to submit those messages via the forms. With that, I am ready for any questions that you may have.
Number one, I need to tell you, I was just my husband just notified me that VBTV has no sound. He's watching us.
Interesting.
So, whatever.
Okay.
If they can check on that. But number one, what do we have to do? Is there anything on our part that we have to do, changing anything as far as setup with our computers or anything like that?
Nothing at all.
We'll if our computer is set up for us to log on to our site, will it automatically go to that, or?
It will,
Okay.
yeah. You don't have to worry about doing anything. Emails sent from these forms will continue to come into your Outlook inboxes as they do today.
Okay. Thank you.
Mrs. Hughes, then Mrs. Manning.
So I have just two questions. One is, and you may have just answered this, will this affect the folders that we already have? Are we going to have to look somewhere differently, or is this still going to look the same to us?
It will look exactly the same to you.
Okay.
The content from the forms will give you the ability to create rules for yourself and how you want to categorize and move messages. So for example, if I go back to the picture of the form for an example, right? So if under the section that says, I have a question, a comment, suggestion, concern, or a compliment, we can, for example, create options that I have a question regarding the budget. I have a question regarding COVID safety protocols or anything else. And what we can do is include that into the, what I will say, the header or the top part of the message so that you can easily organize your inbox using your own rules within Outlook. We are not going to change any of the folders, rules, or anything that you may already have set up.
Okay, thank you. And then you said this will start February 11th. That was my second question.
That's correct.
Okay, and then I just have one more. We have this new group email for internal emails.
Yep.
That's for the whole group, but what if we're just emailing one board member, or maybe on a committee of 3, we just have something internal? How would we do that?
You do it the same way that you
Same
do
as we do
today.
now?
Yep.
Got it.
Your personal email addresses will not be changing.
Perfect. Thank you.
Okay, so I love this, by the way, thank you. The internal email, schoolboard@vbcpsboard.com, is there a way for us to set up our Outlook accounts so that that is like highlighted when it comes through? Because oftentimes we get time-sensitive emails that get stuck amongst 100 other emails.
Sure, absolutely. So I can work with you all about this afterwards. So one of the things that I regularly do, for example, is I have Outlook rules in my own Outlook that will turn an email from Dr. Spence to red and bold it for me, right?
Okay.
So that amongst all of the other emails that I receive, I know that this
Oh,
is one
great.
I need to give priority to.
Okay, so we'll be able to do that.
So yes, you can actually do that today, and I'll be happy to help you do that.
Thank you.
Sure.
And then just one other question, if you can go back to the form page. Down there on the bottom, it says, hide your contact information from the district. I guess I have some concerns about getting anonymous emails, and I don't know how that works with. Yeah, so.
So this was a sample form. What we would do is we would require individuals to provide their email address when they are sending the form. Now, I want to be clear here. Yes, we can require that they enter in an email address. You don't know that
Right.
it is legitimately their email address.
Right, okay. Okay. All right. Well, if they want a response, they're going to have to enter the right one, right?
Absolutely.
Okay.
Absolutely.
Thank you so much. This is wonderful.
Sure.
Okay, Mrs. Franklin.
Mr. Den, I think you are brilliant. And I think that you actually need to have a Outlook class for dummies, because I would totally sign up for that class. So one question I have for you is, 'cause sometimes I will send an email to myself at, Jennifer.Franklin@VBZ, from like my work email or something like that. Can I still, as an outside email, still email myself directly, but without having to do this form?
So that is a great question. Yes, you will. None
Okay.
of your email addresses will stop receiving emails directly from the public.
Okay.
Right?
I just
So
want to be
in
clear.
your scenario, your work email address is essentially the same as a public email account, right?
Mm-hmm.
So no one's individual email accounts will stop receiving direct emails from the public. It is the group.
Okay, that's one.
It's the group board account that will.
Okay, thank you for making that clear.
Sure.
Thank you.
Anybody else? All right, so the next step will be February 11th, and then maybe we will take advantage of a little class. We'll wait and see.
Excellent. Look forward to it.
Thank you very much for responding, to, and it was, I just appreciate it. It wasn't a knee-jerk reaction, there was a period of time where these incidences seemed sporadic, and then it just got to the point where it was too common, and it's just too important a part of our job, and so thank you for taking this so seriously. Okay.
Absolutely. Thank you.
So, we are ready to conclude today's workshop, and we'll reconvene in here at 6 o'clock for our formal meeting.